It's a story we've been covering all week, recognizing the signs and symptoms of breast cancer and identifying the best options for treatment. We're joined by Dr. Danielle Lipoff, who is a breast surgeon at Bay State Medical Center. Thank you, doctor, for being here today.
Thank you for having me.
Yeah, of course. Let's start with the basics. Our first question is, what are the risk factors for getting breast cancer?
Well, one of the biggest risk factors is family history, and I know it makes a lot of women nervous when they've had a grandmother or an aunt or a mother who's been diagnosed, and rightfully so. It does increase their risk. Other risk factors include smoking, drinking more than 2 alcoholic beverages in a week's time, being overweight, late first pregnancy, and all of that sounds scary. So I'm going to flip that to decreasing your risk of breast cancer. Quitting smoking, healthy diet, low animal fats, exercise of 30 minutes 5 times a week also decreases risk of breast cancer significantly, all things that can be modulated by yourself.
Okay, and our second question tonight, I think this is something a lot of women are wondering, how often do they have to get a mammogram?
Currently, we recommend yearly, and the reason for that isn't to torture women to come in every single year for a mammogram. It's because when the radiologist looks at the mammogram itself, they like to see the change of the breast tissue, and having a series of these images and past images really helps to determine if there's something changing and something to be worried about.
Okay, and our third question comes to us from Karen. She told us she had yearly mammograms, and once diagnosed, she was already at stage 3. What's being done to ensure all types of breast cancer are detected early enough through mammography?
That's an excellent question. 10% of breast cancers are not diagnosed by mammograms, and that's a scary number, and a lot of women are scared by that, and that might even lead them to not wanting to have mammograms. I recommend monthly self-breast exams, and the reason for that is to become aware of your own breast tissue. So when things do change, when you start to feel something, that's when you can speak to your physician and say, I think something's being missed. And then there's further workup that can be done when something's being felt.
Okay, thank you, Dr. Lipoff, for joining us here today. And if you have a question you'd like to have answered, you can email them to us at reportit@wwlp.com. Dr. Elizabeth Brady will be joining us on 22 News at 5:30 to answer more of your questions, and we'll continue to answer them on Facebook Live throughout the evening. October is Breast Cancer Awareness Month, and 22 News has been working for you all week on recognizing the signs and symptoms of breast cancer and identifying the best options for treatment. Tonight, we're joined by Dr. Elizabeth Brady, a breast surgeon at Bay State Medical Center, and she'll be here answering all of your questions that you've sent to us through Report It. Thank you for being here today, Doctor.
Thank you for having me.
So our first question is, what are the symptoms of breast cancer, and does everyone have the same symptoms?
I think the most common thing that we see for symptoms is obviously a breast lump. That's what most women think about. But I think we need to be aware of the fact that there are lots of ways breast cancer can present. Things like nipple discharge, changes in the skin. If the nipple suddenly becomes inward when it hasn't been that way, many women are like that anyway. But that kind of change, something that they might see in the mirror if there's thickening of the skin or scaling of the skin. I think the least common presentation is breast pain. Many times women think if they have breast pain, they have breast cancer. Very unlikely. But I would say that's the way the symptoms present. Probably the most common way we detect it is by mammography when women don't have symptoms at all.
Okay, and our second question comes from Sandy. She wants to know what the recommended screening test is for women with dense breast tissue.
I think the most important thing is to understand what we mean when we say dense breast tissue. So about 40% of women who undergo mammography have dense breasts. So it's not an illness, it's a form of normal. But it's diagnosed, or the description is made by the radiologist who's interpreting the mammogram. So dense breast tissue is when the mammogram has much more glandular breast tissue on it, so it's white, versus the fatty tissue, which all women have, which is dark. So as we get older with less glandular tissue in the breast, it becomes easier to interpret it. The tissue becomes less dense, the mammogram's easier to read. So for women who have dense breasts, 3D mammography is a very helpful entity. So with those women, they should be asking for 3D mammography. And then for women who have very dense breast tissue, screening ultrasound. Screening breast ultrasound can be another way to detect something that's in the breast tissue that otherwise couldn't be felt or appreciated on mammography.
Okay, and our third question comes from a viewer who wants to know, what are the oldest and youngest ages you could be diagnosed with breast cancer?
Ashley, breast cancer is not an age discriminator. I've treated patients as young as 22 and patients well into their 90s. So the issue is to know that your breast exam as best you can. Make sure you do your screening imaging and make sure you follow up with your primary care doc or your gynecologist to get your breast exams done.
Okay, thank you for being here with
Thank
us
you.
today, Doctor. And if you have any questions you'd like to have answered, you can email them to us at reported@wwlp.com, and we'll answer them again on 22 News at 6 and live on Facebook throughout the evening. October is Breast Cancer Awareness Month, and this is a story we've been covering all week, recognizing the signs and symptoms of breast cancer and identifying the best options for treatment. We're joined now by Dr. Danielle Lipoff, who's a breast surgeon at Bay State Medical Center, and she'll be answering your questions that you've sent to us through reported@wwlp.com. Thank you for being here today with us, Doctor.
Thank you for having me.
So our first question tonight, a viewer wants to know if breast size affects her likelihood of being diagnosed with breast cancer, and also what about breast density?
There's no difference in risk based on breast size. The average risk over a lifetime is 12%, 1 in 8 women being diagnosed throughout the course of their lifetime. But as far as density, the answer is yes. Breast density does increase your risk, and the reason for that is there's more breast parenchyma, more tissue that makes up the normal parts of the breast to increase the risk.
Okay, and what about treatments that are available for breast cancer? Would you recommend some treatments over others?
Well, in the breast cancer world, we do something called multidisciplinary treatments, and that entails all 3 different parts of a treatment care system. We use the modality of surgery, the modality of radiation oncology, and the modality of systemic therapy. And each is broken down into different parts, and all of the specialists have their own roles that play into it. And it ultimately comes down to the type of breast cancer that you have, whether it's in the lobules or in the ducts, the different markers, the different genetic markers that are found within the breast cancer. All of these really determine what the best treatment is for the breast cancer you have and where the modalities end up, what comes first, and so forth.
Okay, and our last question comes from Tara. She said she's 41 years old and doesn't have family history of breast cancer. She should have gotten her first mammogram last year, but was too scared to make the appointment. She wants to know if there are any tips you have to ease the fear.
It's scary. Absolutely. It's scary to go in and put yourself at risk and the what if they find something, what if I get called back. But the reason we do these mammograms and the reason we do them early is to find something before it becomes a cancer. The earlier we find these lesions, the earlier we find these calcifications on mammogram, the better we can determine if there's something we can do to change their risk. There's better chance if we do find something as a stage 1 or a stage 0 breast cancer that our treatments are going to work even better, and their overall risk is decreased. So I understand it's definitely scary, but I still recommend go ahead, get your mammogram.
Okay, thank you, Dr. Lipoff, for being here with us today.
Thank you for having me.
And if you have any questions you'd like to have answered, you can email them to us at reported@wwlp.com, and we'll continue to answer them on Facebook Live throughout the evening.